Thank you, likes achieved. Good evening, everybody. According to Naomi, you're welcome. So, guys, tonight's information is very important, especially if you have tested positive to pregnancy this past 3 months. This information is important. You don't want to start well and end badly, right? So, we're going to be looking at all the first trimester anomalies. I think I saw Chrissy. Chrissy is here. All right. We're going to be looking at all the possible first trimester anomalies. What can go wrong in early pregnancy and why? The why is the most important part. Thank you very much, Chrissy. I appreciate you. The why is the most important part. I hope you know that the first trimester pregnancy is the most delicate phase of the human life. We've done an extensive discussion on how we got here, but now we need to make sure we don't miss the mark. I haven't done a good job of getting you pregnant successfully. Right. Now that you're successfully pregnant, we want to make sure you don't make mistakes that will bring you premium tears, right? So, understand that this first trimester is when the blueprint of the baby is drawn. We talked about it a few days ago. This is where the blueprint is drawn. For example, if you're going to build a house, for example, you need an architect to draw the structure, to lay it out. Then you have an idea of what's going to be built. So the same thing happens in your first trimester pregnancy. This is where the blueprint is drawn, and it matters how the blueprint is drawn. It matters how the blueprint is followed through, right? So that is why we are having this discussion. Yeah. Those of you sending requests, don't send now. You have to wait. All I need from you now is to tap on your screen, right? So don't send any requests. We'll have opportunity to send requests, ask questions, interact, basically, right? Excuse me. So for now, tap on your screen, call those who need this information to come, because we're talking about first trimester anomalies. And I am saying that this first trimester is where the blueprint of the baby is drawn, right? So if something goes wrong here, it often affects the entire pregnancy. Anything that goes wrong at this stage, the remaining part of your journey will be affected. That's why you don't want to miss this information tonight, right? You should know that globally, about 10 to 20% of pregnancy ends in the first trimester. Why? For many reasons. We've talked about the reasons before anyway, right? Some people's pregnancy ends long before they even get to know that they are pregnant. The pregnancy has ended for the reasons we've mentioned. But tonight we're going to continue in that light to add more knowledge to what you already have heard before, right? And mostly the reason is because of this anomaly that starts very early. Yeah, remember, early pregnancy, first trimester pregnancy, is a place of drawing the blueprint for your baby, right? So let's begin to break this down one after the other. I want you to talk to me in the comment section. Who is ready for this discussion tonight? If you're just joining, commenting is part of the engagement you need to do. So talk to me, because I need to see your name. I need to remember your name I need to interact with you. So who is ready for this all important discussion tonight? Who is ready? Gift is here. Akua is here. I'm ready. Oh, you've been here? Wonderful. Good to see you. That's why you're here. The reasons is the reason why you're here tonight. So I will always advise you, make sure you have a pen, you have a paper, have a good place to sit down, because you're going to learn some things that you may never have the opportunity to learn. And of course, your doctor may never have the time to explain those things, even when it happens to you, right? So let's learn something. So the first thing we would deal with, which is part of the reason, or rather not reason, which is one of the is the reason, and also one of the first trimester anomaly. So we'll start with the most common cause of this first trimester anomaly. The most common cause is chromosomal anomalies. Right? What does that mean? Now, chromosomes, if you don't know, for those who don't know, let me just explain that quickly. Chromosomes are genetic instructions, right? They're genetic instructions. They are the one that determine the traits. They are the one that determine the way you look. They carry the information for the way you look and how your growth pattern will be. That's what chromosomes are, right? If you are going to appear in a certain way, the information is in your chromosomes. You're going to be fair in complexion, dark in complexion, tall, brief, right? You're going to have a pointed nose, blunt nose, flat nose. You're going to have longer pinna. All those information is in chromosome. Is that okay? And a normal human baby, actually a normal human being, has 46 chromosomes. Equal share came from mother and father. 23 from daddy, 23 from mommy. Right? That is what amounts to the 46 that makes up a normal baby. Is that okay? Now, when the number or the structure of this chromosome is wrong, some things happens. The embryo may stop growing. The embryo would it may begin, fertilization will even take place. But when there is a miscoding, misalignment of this chromosome, the body looks at it and says, no, this is not happening. So if it stops growing, the body tends to remove it. And at this embryo, when the structure goes wrong or the number is abnormal, will lead to early miscarriage. And I always tell people, I've said it here many times already, it's not all miscarriage that you cry about. Sometimes your body just saved you from premium tears, right? Your body just saved you from what you will go through for lifetime, for as long as you want that baby to continue to live, because of the abnormality that will come with it. So your body looks at it, this is abnormal, it terminates it for you, right? So that is the body's quality control system. So it's not every miscarriage that you cry about. So like I was saying, that when the number of the chromosome that your baby is supposed to have, when the number is abnormal, when the structure is wrong, the embryo may stop growing, miscarriage will happen early, or even when the baby survives the onslaught of the abnormal chromosome, right? It will be born with genetic conditions that it has to live all through their lifetime, right? All through their lifetime. So that's why we're having this discussion, so that you will have information that will help you take measures that will avoid some of these things, right? Now let's look at the common chromosome problems. Common chromosome problems. Have you heard of Down syndrome before? So talk to me in the comment section. Have you heard of Down syndrome? Down syndrome. You know those individuals with round face, slit eyes. They don't behave normally, right? And several other things that is wrong with them. So that is the first chromosome problem that can occur in this first trimester anomaly. Down syndrome. Now, what happened in Down syndrome is that there is an extra chromosome in chromosome 21. Don't worry about that detail. Just know that there was an extra addition to the chromosome in a particular place, right? So that extra chromosome would lead to that abnormality. But don't worry, it does not happen every time. In fact, I can tell you that this happens in every, let's say, in 700 births, maybe one case, one in 700. So it's still a large number, but that is the global rate anyway, not local. It's the global rate, right? And the risk for this Down syndrome increases with maternal age. See, there's so much that goes on when you try to conceive in your later years. And that's why when I talk to people 35 and above, I'm always brutally truthful to them, so that they know the direction to take for a successful um, uh, pregnancy outcome, right? So I said the Down syndrome risk increases with older mothers, with older mothers, right? If you're just joining, you're welcome. I'm seeing your names, but because I'm talking, I can't welcome you, correct? So you're welcome. So that is Down syndrome. I think the take home here is the risk increase with increased maternal age. Those of you that are trying to conceive in your older years, you are not. It's not your portion, but just know there is a possibility. Is that okay? All right. The other one we should talk about is Edwards syndrome. Has anybody heard of Edwards syndrome? Please talk to me in the comment section. We're just 13 people here, so it will be easy to talk to everybody, right? Have you heard of Edwards syndrome? Don't worry about these white people. They like putting their names on things. They are very funny people. They like putting their names on things. They'll say, "Oh, I discovered it, so I put my name." They discovered nothing, right? So Edwards syndrome is another name. It's easy to remember when you say Edwards, but it's another name for trisomy 18. And this is a very severe form of abnormality, right? Interestingly, most of these trisomy 18 case, most of them end in good enough, most of such pregnancy ends in miscarriage. Thank you very much, First Lady. Thank you. Right? There's also another one they call Patau syndrome, trisomy 18. All these things I'm mentioning, these are just extra chromosome, extra chromosome, extra chromosome. And when there is an extra from the normal, it causes confusion and a lot of abnormal. If the baby eventually comes, there's a lot of abnormal features that is going to be seen, and that will cause a lot of trouble for the parents, right? So the Portal syndrome is trisomy 13. In this case, the baby will have severe brain and heart defects. Severe brain and heart defects. And of course, the survival rate is very low. Even if they are born, they will still pass away. All right? So all this can happen in the first trimester. And that is why I took time to talk about the lifestyle and nutrition that is necessary to help you have a successful outcome in your early pregnancy. So if you miss that one, I hope God will help us to go back so that you learn. But don't worry, there's still much to learn. You've missed a lot already. There's still much to learn, and we'll continue to learn till eternity or till TikTok decide to close. Right? We'll continue to learn. There's another one that is called Turner syndrome. Has anybody heard of Turner syndrome? It's pretty common though. Anybody here, you've heard of Turner syndrome? Turner. Is it my pronunciation? It's Turner. Turner. Right? Turner syndrome. That is another possible anomaly. These are chromosomal abnormalities I'm mentioning. Christy Lebesel is only Turner fish she has heard, not Turner syndrome. Yes, there is such thing as Turner syndrome. In fact, we call it monosomy. Monosomy, right? In this case, it is only one X chromosome that the fetus has, right? Because normally the fetus should have sex chromosome of XX or XY, right? But something happened. It's only one sex chromosome that appeared. And I explained some reasons when I was talking about sperm and how they divide, right? Because some sperm can actually divide and leave a particular sperm cell without any sex chromosome. And if that one fertilizes the egg is already X. So this one is coming without any chromosome, no X, no Y, and it fertilizes it. That's how this Turner syndrome amounts to. So the fetus is just only one X chromosome. Yeah, only one X chromosome. And this is one of the common causes of early miscarriage in females. I tell you, the body has a quality control system. Most of these things you will not see. It is the ones that manage to be bettered that we saw and we are able to study. But most of those miscarriages are because of all these things. And like I said, especially for those that are older. I mean, the mothers that are older. Right? Is that okay? So how many of these syndrome have I mentioned? So who is following? Let me be sure. Let me be sure who is following. How many of these syndrome have I mentioned? How many have I mentioned? All these are chromosomal anomalies that can happen in the first trimester. Somebody said I mentioned only 3. Is that so? I mentioned Down syndrome. I mentioned Edwards syndrome. I mentioned Patau syndrome. I mentioned Turner syndrome. Right? So, it's not enough for me to just tell you this happened, this happened, this happened. Why? And that is what this platform is all about. When it comes to fertility, my job is to tell you why. And your job is to adjust and be successful, right? So who is ready to hear why chromosomal abnormalities happen? Who is ready to hear? Talk to me. 11 people, please talk to me. Who is ready to hear? Please make sure you share this live stream. Share it. I'm only saying 2 shares here. Please share it because there are people who need this information. Oh God. Tomorrow they'll come now and say, oh doctor, this happened. Not knowing that we've talked about it already, right? So please help them so that they can find us early, right? So let's talk about why chromosomal abnormalities happen. I'm sure by the time you know the why, you're going to begin to adjust a lot of things about you, especially those people that are trying to conceive. So shall we talk about the why now? The first why is poor egg or sperm quality. Poor egg or sperm quality. And if you have been here, you already know why egg and sperm can have poor quality. Should I just mention a few? I'm just thinking about those of you who are seeing me for the first time. But there's so much information you didn't hear. So when you're hearing me now, some things will just be sounding like rocket science. So how come egg or sperm can have poor quality? How come? How is it possible? It's very simple. The first culprit to that possibility is age. Nutrition, poor nutrition, stress, lack of sleep, lack of exercise, and so on and so forth. Okay, well, we'll go back all over again. I'm sure but these few I mentioned, very important, right? Very important. Now you begin to know the kind of things you need to adjust in your life so that you don't end up with poor quality egg and sperm. Especially men. While we are here talking now, some of them are watching football. And while they are watching the football, they are drinking ogogoro joint. Right? Right? That's why I tell you, it's important you have your brother, your colleague, your neighbor who are men, even your spouse, to join this live stream. So it's good to let everybody hear. So that's poor egg So the first reason why there's chromosomal abnormality is poor egg and sperm quality. Second reason, age, advanced maternal age. I said maternal. When I was talking about sperm and egg, I talk about age for both individuals, male and female. But now there's the maternal factor, especially those that are above 35. Especially. So most of that miscarriages you'll notice is your age. Your age is one of those factors that is affecting. Right? Wendy. Is that Wendy? Wendy is here. Advanced age, especially those above 35 years of age. Right? If you're just joining, we're talking about why chromosomal abnormality happens in first trimester pregnancy. That's what we're talking about. Loveline is here. The next thing the next reason is error that can happen during fertilization. So we talked about fertilization in details. So the error that can happen during fertilization is one of the reasons why there will be chromosomal abnormality. The error that happens. So I'm not going. It's a whole lot of. It was a complete episode, so I'm not going in that direction so that I don't take up the time. But I'm sure we would go back to that gist soonest, right? So error that can happen is one of those reasons. Then random natural mistakes. That one is not in your hand. And it's actually one of the common things. And one of the things that God has done that we can never understand, however much we want to try to study it, we don't know how this egg, sperm, chromosome, genes, the force that selects them to do the kind of things they do. Right? There is a force, supernatural force that is making it happen. So that natural happenings does make mistakes too. But that one is not in your hands. So when that mistake happens, the body have a quality control system, a quality assurance that makes sure that even when nature makes mistake, it will not amount to something that will cause you pain. It eventually will end up in miscarriage. Right? So I have mentioned the reason why chromosomal abnormalities happen. The first reason is poor egg and sperm quality. The second reason is advanced age for the mother, maternal advanced age, especially those 30 and 35 and above. Good evening, Loveline, I see you. Then error that happens during fertilization. Then finally, random natural mistakes. Nature does make mistakes and it corrects itself, right? And that's this random natural mistake is actually one of the most common of them, especially if you have taken care of the rest by yourself. Age, your poor sperm and egg quality, you can actually influence that. Maternal age, you can influence that. You can choose to start having or start your family early to avoid all those problems, right? Then there is the error in fertilization. Now, do you know that over 50 to 60% of first trimester miscarriages are actually due to these chromosomal abnormalities? And that's why I keep on saying It is not every miscarriage that they cry for. Your body is saving you from premium tears. Right? Eniola, good evening. You're welcome. So that is the body's quality assurance system to make sure that even when there is an error, it terminates it quickly. Terminates it. Right? So, can we move on now? If you understood anything up to this point, please type in the comment section understood so that we can move on to the next thing. Remember, we're talking about first trimester anomalies. All the abnormalities that can happen in a first trimester. That's what we're talking about tonight. So if you are here, you understand up to this point, say understood. If you are just coming, don't say anything because you have not learned anything. The next one, oh boy. So don't worry about the background noise. You know, it's Christmas season and people are doing all manner of things. So just stay with me. Don't be distracted. All right. The next thing we want to talk about is neural tube defect, NTD. For those who were here when I was talking about the necessary nutrients that can help you support your first trimester pregnancy, this was one of the things. I just mentioned it in the passing. I did not explain. So we have an opportunity to talk about it. All right. Neural tube defect. Just so that you understand what I'm talking about. It's about brain and spine problems. Brain and spine problems. 11 people in the FYP, I see you. Right? So what is neural tube? Let's start from there. You say, big grammar. It's not big grammar, just something simple. What is neural tube anyway? Neural tube basically forms the neural when fertilization takes place and the cells begin to divide. It gets to a point where the cells are so divided and now they rearrange themselves to begin forming a human being. So one of the first things that is formed is the neural tube. And this neural tube is what forms the brain and the spinal cord. Is that okay? And this usually happens by week 4. By week 4. The 4th week. Long before some women even know that they are pregnant, before they can even confirm, neural tube is already forming. You see why some people don't know, they'll go ahead and take certain drugs and they start bleeding and they have miscarriage. They say, oh, maybe it's my mother-in-law. It's not your mother-in-law. It's because this information I'm giving you tonight, you didn't know before. Before you confirm that you were even pregnant, neural tube is being formed. Now, the common defect that can happen when you distort this process, if you distort this process, the common defects that can happen. Have you heard of anencephaly before? There is something we call anencephaly. Anencephaly. Have you heard that before? This is a situation. It's actually a fatal condition, right? It's actually a situation where the brain does not develop fully. The brain does not develop fully. Why? Because it's a defect of the neural tube. Right? Also, spinal bifida. Remember, we're talking about neural tube defects, and neural tube is what forms the brain and the spinal cord. So the defect The first one I mentioned is anencephaly, and the next one is spinal bifida. This is the failure of the spine to close properly. If it, and the severity varies anyway. It's a spectrum, right? If the baby is eventually born, you'll notice the defects at the back of the open, exposed spinal cord at certain level. Some may even pass away before they were born. Some will be born with it and eventually pass. And some may carry it for certain time of their life and parents will suffer. Right? As usual, I'm telling you what can happen. So the question is, why does this happen? This anencephaly, this spinal bifida, why does it happen? It's a neural tube defect. You see this folic acid that they're asking you to take. It's not because they are looking for what to give you and collect more money from you. That's not the reason why they're doing it. Folic acid deficiency will amount to these things I just mentioned. You want your baby's brain to develop properly, spinal cord to develop properly. You want to take that folic acid seriously. Take it seriously. Somebody told me, oh, it doesn't smell nice. Yes. Have you not noticed that it's all the things that are unpleasant that actually works well for the body than the one that are sweet? Right? Folic acid deficiency will cause your baby anencephaly, poor brain development. The spinal cord will refuse to close because the mother said folic acid smells a lot. You want to take your antenatal drugs seriously. They're not giving you for nothing. Okay, that's the first reason why that can happen. The next reason is also on nutrition. Poor maternal nutrition. The food, you are not eating it adequately. It's not even nutritious. And even the drug they are giving you still don't want to take. And you think problem will not come. This is where the problem is coming from. Poor maternal nutrition. So you want to take balanced diet seriously. The next one, certain medication. I will not talk more on this one because it's up to your doctor. And again, you have the right to ask your doctor, doc, this thing, is it good for my condition, for my baby? Whatever they give you. So it's right for you to ask. Because there are certain medications that can cause this problem. One of those anti-epileptic drugs too can cause that. But I will not go into those details. Let your doctor worry about that. And diabetes also, maternal diabetes can cause this. If you understood anything up to this point, talk to me in the comment section. Because I want to be sure that people are listening to me. Talk to me in the comment section. You understood. Do you know that there are some countries that are not particular about folic acid supplements? And we know that countries that have this routine supplementation of folic acid, they have reduced this kind of abnormalities down to 70%. They reduced it down to 70%. This neural tube defect. Who is talking about blighted ovum? You are looking for my trouble, bah? Just keep on tapping on your screen. Share the live. All right. All that, even the blighted ovum you're talking about, go to my video, go to my profile. I did a very excellent job. 1 minute video. Everything you need to know is there. Go and learn. It's all about genetics, chromosomal failure. All right. No, don't take me back. That's why I said you're looking for my trouble. Don't take me back. But don't make sure you don't miss my live stream. If you really want to learn anything about fertility, don't miss my live stream. Because if you miss, don't worry, you go pay. They go teach you. They will pay. You'll pay. Right? So we've talked about neural tube defects, under which we looked at how anencephaly, poor brain development, and spinal bifida occurs. Now let's go to the next thing. Let's talk about early cardiac anomaly, heart and anomaly. Right? Heart anomaly. The heart begins forming at about the third to fourth weeks of gestation. That's why one of the earliest proof of pregnancy viability is heartbeat. That is how early it begins to form, from 3 to 4 weeks. Right? Mary, you need koboko. When it's time for question and answer, come up and ask your question. We'll answer you. Is that okay? All right. So, the possible problem that can happen with respect to the heart is a septal defect, what you call hole in the heart. Hole in the heart. I'm sure most people have heard that. You've heard that a lot of times. Say this baby has hole in the heart. So these are one of the anomaly that can result in first trimester. All right. There's also the abnormal heart position that can happen, and poor. Normally you have 4 chamber, so you got poor chamber development can happen in this first trimester. Yeah. What causes it? Anything I say here, the most important part is why. It's not, some of you just hear this grammar is too big for me. Don't worry about the grammar. Just understand the concept. Why? Why does this happen? Because at the end of this discussion today, many people will take their first trimester pregnancy seriously. 3-4 months ago, I told you guys that those who have been here anyway, we're going to have an avalanche of pregnancy positive tests in December, and it's already happening. So now that you are getting pregnant, it's my duty to now tell you to be careful, because something can go wrong. So I'm not going to just tell you what to do and leave you in the desert. We got to follow up this pregnancy until the baby comes. I'm going to travel, but I think by the time people start delivering all around the world, I will be traveling all over the place for naming ceremony. Because we did this together. Oh boy. Edo finest. Yes. You want to wait until It's time for question and answer. Is that okay? So invite me wherever you are in this world and you are already testing positive to pregnancy. When the baby comes and it's time for naming, invite me. Africans, we take naming ceremony seriously. I don't know about those people outside Africa, right? But we take naming ceremony seriously. Why? Because first, we value children. Secondly, the name you bear is very important. Look at African names. You will understand what I'm talking about. Right? So the name you bear matters. That's why we have ceremony for naming. Right? So to show you how important it is. All right, let's talk about the cause of this heart or cardiac anomaly. What can cause it? There is the genetic factor. Right? Poor oxygenation. If you were here when I was talking about placenta development, you understand what I mean by poor oxygenation. Right? And also when we're talking about nutrients necessary to support early pregnancy, right? When we talk about iron, you understand what I mean? Because if there is poor oxygenation, you are more likely to have these issues. The heart has to function adequately, efficiently, regardless on the stage. So when there's poor oxygenation, that optimum function will not be there and you have some issues. Maternal infection like rubella can cause it, right? Even diabetes, maternal diabetes, and exposure to alcohol. This is about a million time now I'm talking about alcohol on this live stream. If you are taking alcohol during pregnancy, you want to be careful. You want to stop. You want to stop now. By the way, you should be stopping before you even start trying to conceive. Because when you expose that early phase of development to alcohol, a lot can go wrong. Right? Now, congenital heart defects are most common defects worldwide. And this affects about 1% of the live births you see. Now, one time, they requested an ultrasound examination for a newborn. You see, there is kind of job you do, you are exposed to certain things. Some things can never remove from my mind. Because how do you begin to explain that this child who just came has not even tested life, is already suffering this much? How do you explain those kind of things? This is one of the motivation for this live stream anyway. So it's not, that's why I don't bother about telling people to give me gifts and all that. If you appreciate it, good for you. If you don't, good for you. But just pray. I pray you do what I'm telling you. And this is not your portion. Because you need to see what people who have kids with defects, you need to see what they go through. Some of these things affect even how we that is taking care of them. It affects our mental health. Then no. Because now you're getting it for free. Learn it. The next time you hear it for somebody else, you have to pay dearly for it. All right. So. I just slipped into a direction I was not supposed to go. Right? Some of these things, it touches me so much. I'm always touched by the feeling of the infirmity of these people. And when I remember like that, I get so emotional. Right? Anyway, so let's go to the next one. Now, you could have a failed implantation or abnormal implantation, and this will include. Now, listen. Somebody mentioned this in the comment section. Abnormal implantation or failed implantation includes blighted ovum. Go to my videos. It's there. I've talked about it. Includes blighted ovum. And in this blighted ovum, you can have gestational sac that is formed, but no fetus is developed inside. More like you have built a house, but no human being to occupy it. You will test positive for pregnancy. Yes, you will. But there's no baby forming inside. That is blighted ovum. Right? So that is blighted ovum. There's also early embryonic demise. Early embryonic demise. For those of you that were here when I was talking about early pregnancy loss, I mentioned these things also. So it's just for people who were not here so that they know. Early embryonic demise. Here, the embryo is formed. Excuse me. The embryo is formed, but it stops growing early. Pregnancy started and stopped. It doesn't grow, no heartbeat. What happened? That's why you're here. That's what I'm going to answer. Why would implantation fail? That is bringing about blighted ovum, that is bringing about miscarriage. Why? What happened? All right, we have stopped tapping. I know my people now will claim that they were writing, that's why they stopped tapping. So let us tap small, eh? Good people of God, let us tap small. Queen is here. Good people of God, let us tap small. Remember, when you tap, there are people that will see us and join. You be shocked the amount of people in the FYP that are watching us. So it's not just you, it's also for them. All right? Can you notice as we are tapping now? Can you notice the number is going up? And that's what we want. Thank you, Wendy Royalty. Thank you. Make sure you claim your points, please. Claim your points in that heart close to my name. Tap it. You see, claim. Only for those that have dropped a heart me. Right? So make sure you claim it. Right? So why does implantation fail? That is giving us blighted ovum. That is giving us miscarriage. Why? Why does this happen? A few things that I will mention to you that can help is poor endometrial receptivity. Oh, English language. Oh. The inability for the endometrium to receive embryo for implantation. That is the grammar I wanted to blow before. Yes, and that person that was asking me about endometrium, that is what I'm talking about. Inability. So it's not enough. It's not enough that fertilization take place. Can the embryo implant? Is the endometrium receiving it? Because when the embryo comes, the first thing it does, it goes closer and stick to the wall. When it sticks to the wall, the next thing it does is to start digging into the wall. So, does your endometrium have the quality of receiving this embryo? Several things happen when pregnancy fails. So, now that you are informed, the next time you're going to try to conceive, you are going in with knowledge, and nothing will stop you from having the results you are looking for. And it's a guarantee. It's a guarantee. When you are acting in the place of knowledge, nothing will stop your results. But sometimes when you go blindly, and of course, unfortunately, because what do you call it now? Healthcare is big business. I hope you understand that. It's $1 trillion business around the world, healthcare. Because it's big business. Those of us that are spending much time giving details, we don't make that kind of money. Like those who are telling lies and deceiving you. Don't worry, the world will be a better place for everybody one day. So we're talking about why implantation fails, right? Poor ability for your endometrium to receive the embryo for implantation, receptivity, right? Hormonal imbalance. Here, when we're talking about implantation and we mention hormonal imbalance, what should come to mind is low progesterone. Remember, progesterone is what we call pregnancy protector, and it's also what is responsible for the development of the endometrial lining. So if it's low, a lot will go wrong, right? A lot will go wrong. It also helps to relax the contractions that happen in the uterus, including relaxing the impact of your immune cells against the embryo. So progesterone does a lot of things. Progesterone does a lot of things. So you cannot afford to have low progesterone. You cannot. And I said it the other day, those of you that have had issues, maybe you have a threatened miscarriage, what does your doctor give you? What is that injection they give you? Progesterone. Because that hormone is pregnancy protector. Look at the many things it does. Make sure you hold your doctor tight in this early phase of pregnancy. If you feel or see anything that is amiss, go and see your doctor. Don't wait. All right. So I mentioned poor receptivity of the endometrium, low progesterone, hormonal imbalance, immune rejection. Immune rejection. Your immune cells are always in the endometrium to fight. It's fighting infection. It's fighting sperm. It's also fighting embryo. What is supposed to be your baby. It's serving a good purpose, but again, sometimes it cannot differentiate between what is a baby and what is not, because the embryo is carrying the gene, the genetic makeup of the daddy, which is not recognized by your body. So that's why you need progesterone to step in, say, hey, calm down. This is good. This one is good. This is family. So implantation failure can happen due to immune rejection. And I just told you why and how it happens. In your immune cells fight against. First of all, it even fight against the sperm when they are coming. That's why you cannot afford to have low sperm count. Because millions of sperm in this journey will be destroyed. Just imagine you produce millions of cells, 40 million, 60 million, 300 million, and it's only 200 or 300 cells that get to the fallopian tube. A lot happen on the way. You see why low sperm count is the issue? That's not the gist for today. I just want to give us some clarity, right? All right. And also chromosomal defects, chromosome defects. I mentioned that. So these are all the reasons why implantation can fail. Reasons why you can have early embryonic demise and blighted ovum. Is that okay? About 25% of early pregnancy failure is as a result of this. Right? As a result of this. Please let's not stop tapping on our screen. Tap on your screen. Thank you. All right. So if you understood anything up to this point, please communicate with me in the comment section. Understood. Let's be sure that you are still here. Is it understood? Okay. The next thing we're talking about, early pregnant, first trimester anomaly. We cannot continue without mentioning ectopic pregnancy. Ectopic pregnancy. The simplest way to describe ectopic pregnancy is pregnancy in the wrong location. What happens here? What happens here is that the embryo implants outside the uterus, and it's commonly in these areas like the fallopian tube. In fact, 95% of ectopic pregnancy is in the fallopian tube. 95%. All right? So we have ectopic pregnancy in the fallopian tube. Ectopic pregnancy can occur in the cervix. Ectopic pregnancy in the ovaries. Ectopic pregnancy in previous CS scar. Right? Scar niche implantation. Why does this happen? This ectopic pregnancy can happen because of something like tubal damage. I would to God some of you were here when we were talking about that earlier, because I gave all those details. Now I'm not giving details, I'm just mentioning them. Right? Tubal damage, whether the tube is damaged due to infection, scarring of the tube, constriction of the tube, and those kind of things that can happen. Even blockage of the tube. Pelvic infection also can be a reason for ectopic pregnancy. If you don't know now. It's a reason why you must take treating infection seriously. If you've had ectopic pregnancy before, you are at risk of having another one. That's double trouble, you know. Double trouble. You are at risk of having another one. And those who have done IVF, you have a slightly higher risk of ectopic pregnancy. Yeah. So, excuse me. And of course, ectopic pregnancy is a medical emergency. It's a medical emergency because it can rupture and cause internal bleeding. People who are careless about this have lost their lives because of it. So it's a medical emergency. You don't pamper it. You take action immediately, right? And this is anyway about 1 to 2% of all pregnancy is ectopic pregnancy, but it's not going to be your portion. Amen. Right. All right. All right. It's almost 9 o'clock. It's almost 9 o'clock. So let me give you one more thing before we open the box for discussion, for contributions, questions. Yolk sac abnormality is actually an early warning sign. Do you know that the yolk sac can be abnormal too? Remember what we said about the job of the yolk sac. The yolk sac is the first place where your baby feeds from, the embryo feeds from there before placenta is formed. Yolk sac is the first place where the baby feeds from, and the yolk sac is where first blood cells are formed that circulates in the baby's body. Yes, yolk sac can be abnormal, and when it is abnormal, what you find is either the yolk sac is too large or the yolk sac is too small. The moment your doctor sees yolk sac that is too large or too small, the doctor already know that this pregnancy will not continue. It's a poor prognosis, right? If this yolk sac is irregular in shape, poor prognosis. If the yolk sac, Eve, hi Eve, good to see you. If the yolk sac is calcified, looking whitish, poor prognosis. The moment your doctor sees that, you just know that all these often will predict early miscarriage. The doctor already knows this is heading for the rocks. It also will amount to poor embryo development. If you even try to advance, development will be poor. All right. Question and answer time in few minutes. So just tap on your screen, share the live, follow me. Edo Finest, go ahead.
Hello, sir. Good evening. Good evening, sir.
You're welcome.
Yes, sir. I went for IVF treatment. And after the treatment, then they took my the eggs. Then when it was time for them to put it inside me, they told me my womb lining is tiny, that they cannot put the embryo.
Okay.
So that is why I'm asking if there's medication for womb lining.
I thought they did the hormonal test, right?
They did though.
And they did ultrasound test.
Yes.
Okay, so one of the easiest way to know if there are two things that they would have seen used to know whether the lining is good enough: ultrasound and also progesterone. If your progesterone level is low, it's the more likely the endometrium will not be developed. So if they see that kind of thing, of course, they would have be giving you medication on that to help long before the transfer time. You understand?
Yes, sir.
So did they delay the transfer till another time?
Yes, they said I should come for treatment for the home learning before they will not transfer it.
Good. Good. So work with your doctor. Make sure you do what they ask you to do. It's important that your endometrium is ticking. What's your age bracket? 40, 30, or 20s?
30s.
Good. So work with your doctor. You'll pull through. You'll pull through. It will work for you. Is that okay?
Thank you, sir.
You're welcome. So so you are in a good place. Don't worry. You will you'll get your result. So who is coming up? I'm seeing questions. I don't want to read. I'm seeing questions, but I don't want to just come up and talk. All right. So who is coming up? Nobody. Okay, that's good. That means I'll go early today. Your network is not good. Hello, BK.
Yes. Good evening.
Good evening, welcome.
Okay. So, my question is that I saw my cervical mucus, let's say today, yesterday, and today. And then after meeting my husband, I started feeling this intense pain as if I'm having an infection. So my question is that is it that is a problem with me or what?
When you say intense pain, I'm not sure what you mean.
The pain was very, like I can't explain. It was very, it's
So
very
for how long has the
painful.
pain been?
Like when you just that day after seeing the cervical mucus.
Don't worry, man. Don't worry about it since the pain has gone. All right.
Okay.
Don't worry about it. But if it comes and goes, that's where you need to go and see your doctor. They may do an ultrasound scan to see what the cause may be. Is that okay? So I don't think
Okay.
you have a real challenge.
So,
It's not a real challenge.
oh, okay. So the reason why I asked, I said, is there any chance for me getting pregnant?
Why not? Everybody have a chance to get pregnant. Everybody. Think of anybody right now that you are feeling like is not going to be possible. Think of that person. That person have a chance.
Okay.
What's your age bracket?
Thank you. You said?
What's your age bracket? Your age bracket. Are you
Okay,
in your
I'm 20.
40s, 30s, or 20s?
No, I'm in my
You're in your
20s.
20s, and you are worried about the chances of getting pregnant.
Newly wedded couple now.
How long have you been trying?
So it's 1 year.
1 year. 1 year exactly.
Yes.
So if you are so much in a hurry, all you need to do is to go and do semen analysis and do an ultrasound scan to see if there's any. Right. So these are the things you need to start with. Is that okay?
Okay.
And make sure you are meeting during
Thank
your
you.
fertile period. Make sure you are meeting during your fertile period. Because anything you are doing outside your fertile period is just for your own enjoyment. Does not mean anything.
Pleasure. It's okay.
You're welcome.
Thank you.
Is there somebody coming up? Anybody else? Nobody? So that I can go. Thank God today is Friday. I don't do live stream on weekends. It means that I'm going to enjoy my weekend till Monday. Live stream is only Monday to Friday, 7 p.m. Nigerian time. So after today, no live stream till Monday. So if you are just joining, you're welcome. We are about to go actually. Take the opportunity to ask your questions now. And for those that may need a private virtual consultation, it's not free, of course. Just send me a DM. I'll send you a subscription link that you can use for us to have the consultation virtually. So that option is open to you. And also that also means that you would be added to the green app. The green app, all the information and more that I give here, the information is more there anyway. Twice a week I drop them in the green app. So even if you don't hear very well, you definitely get it in the green app. So there's so much to learn every time. So you want to take advantage. Anyone that works for you, take advantage. But if you want to hit my DM, please send a DM on TikTok. Then I'll send you a link for which you can subscribe to join me in the green app and also for private consultations. Right? Wherever you are in the world, is the same. Is the same process. All right. And I have many complications. Who is talking? Attractive beauty. I don't know what you've said. Send your request. Let's talk. Before I go, send your request. But make sure you are following me. Otherwise, we will start by quarreling before we start talking. Is that okay? Send your requests. If you are in the comment section, you have a good send your request now. Today is Friday. You will not see me on TikTok till Monday. Right? This your name that is a broken heart. Not come break our heart here. Who is this? Who is this? What's your name? Wonderful. Your network is not good. Your network is not good. Attractive beauty. Hold on. I want to be sure who this is. Can you hear me now? Can you talk? Or your network is that bad? Okay, her network is bad. She can't talk. So attractive beauty, go ahead.
Good evening.
Good evening, attractive beauty. You're welcome.
Thank you.
So, what are you saying? I don't understand what you're saying.
Like, I'm on my 8 month, 8 weeks pregnant.
8 weeks or 8 months? Which one?
8 weeks, 8 weeks.
Mm-hmm.
And I normally have discharge.
Okay.
An inch. I don't
Have
know
you seen your
what.
doctor?
No, I've not registered yet.
Even don't wait for registration. Go and see your doctor. Let us know why this discharge and itching is happening. Don't you understand? I hope you know. Hope you know that infection can cause miscarriage. Hope you know.
No, I don't know like
Okay,
that.
now that you know. Now that you know, tomorrow morning, go straight to the hospital. Let's go. Let's confirm what's going on with you. Is that okay?
Okay, but is it normal?
That's what I'm telling you. It's not normal. You need to go to the hospital. Let them test and be sure what's going on with you. Do you understand what I'm
So
saying?
I understand which test can I go for?
No, no, no. I'm not going to tell you the test. Go to the hospital, see your doctor, explain to your doctor. Say, I'm pregnant too, and I'm seeing this, I'm seeing that, I'm seeing this. Then your doctor now will tell you the tests you will do to confirm. Is that okay?
Okay.
Uh-huh. When you do that, if there is need for any treatment or anything, they will do that for you and you will be fine. Is that okay?
Yes, it's okay. Thank you.
All right. Do that and we need to know the outcome eventually, right?
Okay. Okay. On Monday, right?
Please, I'll need you to go tomorrow. Don't clinics open on Monday in your area. Where are you streaming from?
Asaba.
Uh, Go to the clinic tomorrow. Then on Monday, let me have the feedback. Is that okay?
Okay.
All right.
Thank you.
So I'll look forward to see you on Monday. All right. Who is this? Mara's mom. Mara's mom. Welcome. Hello, Mara's mom. Do you have a question? So please, let's take one or two questions before we go. Thank God it's Friday, so we have the whole weekend. So you really want twins? Were you here when I was dealing on the issues of twins? Were you here? Were you here? So now number one, possibility of twins. There would have been twins in your family, right? Especially you that is the woman side, right? Number two, people that are older are more likely to have twins. Number three, a certain nutrition that has been shown to increase your possibility of twins. And they mentioned yams. That's why there's those people in Ibadan or your state, Nigeria. That place is known for twins, for twins. And they said it's because of their yams, right? That is not a confirmed statement, but studies have shown that. Yeah, Igbora, your hometown. I beg, send me yam now. Eh? Me too. I need to have twins. So everybody, make sure you are grabbing Mola. She needs to send us that their yam that is giving people twins. Eh? Please, I beg. If we need to kneel down, we will kneel down. Send us yams. That yam that brings twins. Let us have it. Then the last thing I wanted to mention is IVF. IVF. Oh, you're even currently carrying twins. Hey, can you imagine? So is it only you that will have these twins? Have mercy on us. Send us the yams. Let us eat. Right? Compliment of the season. Angel's Diary is here. Abeg Mola. Abeg, where is I again? Where is she? This your twins blessing. I must collect her. If you are not grabbing Mola by this time, I don't know what you are waiting for. She's not only carrying the twins, she's from the place, headquarters of twins in Nigeria. If you don't grab her, who you won't grab? Huh? Patients, go to the hospital. Go to the hospital. Go and see your doctor. Hello, Happy. Is he Happy what? Happy B. Hello, Happy B. How are you?
Good evening, sir.
Good evening.
I'm fine, sir.
Talk to me. You want twins too? Your network is bad. Your network is bad. I can't hear you.
Yeah, but I can.
Mm,
Okay, let me.
go ahead. Let's be sure.
Okay. I want to ask a question. Can someone that has 1.01 as AMH get pregnant?
No, you should be asking me other questions. Look for another question and ask. What is really the issue? Because you're asking me something from your test results. Tell me the real issue.
That's the issue. That's the issue. Because I did
Why is it?
an AMH test.
Why
So
did you do AMH test? That's what I want to know.
because I've been trying to get pregnant, so it's not coming forth.
How long have you been trying?
Oh, let's say um let's say a year now.
Okay. So what have you done?
I've done ultrasound.
Hmm.
I've gone for the ultrasound and this AMH test. That's all.
Hmm. What about semen analysis?
Yes, the semen analysis is okay.
So every other thing you've done is okay. Your menstruation is regular. Your
Yes,
hormonal profile is okay. Your fallopian tube is
yes,
patent.
yes.
So the only thing, what is your age bracket?
33.
In your 30s.
Yes.
Are you up to 35?
No, no.
Good. So keep trying, right? And make sure you are meeting during your fertile window. Otherwise, any other thing you're doing, you're just doing for pleasure.
Okay, sir.
By the way, your AMH is not a problem. I don't know why you want to blame AMH for this matter now. Your image is not the problem. Even with your age, you should not be worried about the image. But anyway, no problem. Just do what I ask you to do. Make sure if everything I ask you and you said is okay, then the
Yes.
next thing is meet at the right time.
Okay, sir.
And that is your fertile window. Do you know your fertile window?
Yes.
Good. So go ahead and meet at your fertile window. And if that does not work, then take the option of IVF.
Okay, sir.
But with all the things you have mentioned, you should be able to conceive naturally.
Okay.
Yep. So do that. Make January no end. And I know here you say you are positive. So
So I
you
need
have
it to
you
happen.
have you have a you have a target of January,
Okay,
right?
sir.
You
So I'll come and
target
give my
your
testimony here.
yes, so people have been giving testimony, so your own will be the next one.
Yay.
Concentrate on fertile window. Don't forget about any other thing. Eat well, rest well. What do you do for a living first? Let me be sure.
I'm an entrepreneur. I deal on fabrics.
I asked that question because I want to understand the kind of your stress level. That's what I'm asking for.
Okay. I deal on fabrics. I sell fabrics, all kinds of fabrics.
So how would you in a scale of 10, how would you rate your stress level per day?
Maybe 5.
How many hours do you sleep?
That's the issue.
Okay. Now you are going to take your sleep seriously, right? You need 7 to 8 hours of sleep because lack of sleep, especially at night, will will increase your stress hormone. And stress hormone is not friendly to your eggs. It's not friendly to your fertility. So even though everything is checking out fine, stress can be a problem. Nutrition can be a problem. Lifestyle can be a problem. Do you exercise?
Mm, no, not really.
Because you are in Africa, you are a Nigerian. I can almost guess that you don't smoke and you don't drink.
No, no, no.
So that one is out of the equation. So where your problem lie now is sleep, stress, exercise, and chop better food, right? All this I just mentioned is for the both of you, not just only you.
All right.
Yeah, January is how many days? Is 31 days or 30 days? I think it's 31 days.
Take one.
January
One.
31 should not pass before I hear your testimony.
Amen.
You don't have any problem. You don't have any problem. So there's no reason why you should not conceive. Is that okay?
All right, sir.
Oh,
All right. Mola, thank you. Thank you
thank
very much.
you.
Nelly. Nelly.
Yes, yes, prophet.
No, I'm not a prophet. I'm not a prophet. I am I am
Good. If
Dr. Godwin.
yes, doctor. How are you?
Good evening. Good to see you. I'm all right. So what's the matter?
Um,
The matter is, I'm also trying to conceive.
Then conceive. What are you waiting for?
I am just trying, but I can't.
Why? Tell me what's going on. Tell me.
Ah, I cannot tell you. I don't know what happened.
What's your age bracket? Are you in your 40s, 30s, or 20s? What's your age bracket?
I'm 42.
Okay. Do you have other kids or you have none?
Yes, I'm having two.
Already. How old is the last one?
The last born is now 7.
7 years. So you were doing family planning or something?
Yeah, the patch.
Oh boy. All right. So your message is still regular?
Yeah, yeah.
So what have you done since you have been trying? For how long have you been trying?
It's now like for the whole of this year. It's now ending.
Hope you know your fertile window.
Um, I think I'm struggling there to get it right.
Okay. Now we are talking. Do you have regular menstruation?
Yeah, yeah. Right now, I had started on the 16.
No, I know. I want to be sure. Is this regular?
Yeah, it's coming every month. Every month.
Good. So one of the things I need you to do, you need to you need to go and you need to do a HMH. Is a hormonal test. Let us
Yeah.
know your ovarian reserve,
Okay.
right? Because at that age, egg quantity and egg quality is
Yeah.
reduced. So
Okay.
it's gonna be kind of you need the extra work to get the results you're
Okay.
looking for. So we need to know what your AMH is, right? If the AMH is still adequate, we also need to know whether you are even ovulating. So when you may
Okay.
want to do tracking that can
Okay.
folliculometry can help you, right? But I'm sure you are
Uh,
seeing your doctor.
yeah. I make an appointment for. He said I must go back on the 6th of January. To go and draw blood and everything.
Good, 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 good. So do it.
Yeah.
But again, with your age, the chances are low. You have like less than 10% chance for natural
Yeah.
conception. Would you consider IVF?
Uh, IVF, IVF is here in Namibia. I don't. Yeah, it's here. But how do I go on that one? I'm not sure. I'm not even aware of it.
Mm, no, it's just to go to a good fertility clinic. Then they
Yeah.
will walk you through. IVF is just basically what they will do. They collect your eggs. If you have quality eggs, they'll collect it.
Yeah.
They'll collect the sperm, fertilize it outside the body, then introduce the embryo back into your body. Then you can have your baby. If everything goes out
Oh,
well, right?
okay. Yeah.
I know it may not be that popular in some African countries. I know, but again, it does exist. See the reason why I want to relocate to some of these places. I should just relocate.
Yeah, like in Namibia. Like in our country, maybe in Namibia, it usually used to be done, but maybe I don't even know. We don't have those such a lot of
Yeah, it's
clinics.
done. It may not be popular. It may not be popular, but it's done. I have a lecturer who goes to, I don't know where is it, Namibia or Tanzania,
Yeah.
because they don't have the experts there. They have the clinic, but they don't have the experts. So my lecturer will go to the country, do
Yeah.
the job, and come back to Nigeria. So I know that manpower is the problem. So
Oh,
anyway, let's see what happens. But again, let's focus on you. Let's focus on you. Do the things I just told
okay.
you to do, and
Okay.
it will work like magic. But have it at the back of your mind that your age is also a factor that is working against you.
Okay.
Right. So do that and let us get your testimony as soon as possible. Is that okay?
Okay. I will.
Yeah. It's not
How am I going to get you now? If I have to go and get the result, maybe. Yeah.
okay. You'll get me in my DM. Of course, but you pay anyway. You pay. So I will send you. I will send you a subscription link. So you send it to
Okay.
me, and we'll work around it. But
Okay.
meanwhile, so that I don't forget, you send me a
Okay.
DM on TikTok so that I know it's you. Is that okay?
Okay.
All right. You're welcome. So who's next for a question? Is 10:09 is more beyond the 9:30, so it's time to go. So if there's no more question, guys, I have to go now.